Hi, this is the second video on easy bruising. Have you noticed that some individuals who are seemingly healthy have a history of developing bruises on their extremities with minor trauma? In my experience, it usually occurs in individuals who are active and/or participating in regular exercise. This is sometimes called easy bruising syndrome. It usually occurs in women who are in their 20s and 30s, but it may occur at later ages also. It is thought to be a vascular disorder. This is a benign disorder and usually does not require extensive investigation by the physician. But as with any bruising, any easy bruising, one has to consider the possibility of a serious underlying disorder. Senile purpura is common among the elderly. The discolored spots of senile purpura have also been called blood spots or skin hemorrhages. The initial signs of senile purpura are purple or red bruises that have an irregular shape. The bruises are not the result of bleeding disorders, a lack of vitamins or minerals, or a sign of significant injury. The colors will usually not darken or lighten much as the spots progress. After the bruise has healed, however, a yellow or brown stain may remain on the skin. Senile purpura itself is not harmful, but it may be a sign of an underlying condition. Now, I think we should take a look at abnormal bleeding in children. It is not common. The physician will consider platelet disorders and coagulation disorders primarily. Coagulation disorders are suspected when the child has widespread bruising or prolonged bleeding after a cut or surgical procedure. They are usually a result of problems with clotting factors. Let's review the clotting process for a minute. Clotting factors are proteins in the blood that control bleeding. When a blood vessel is injured, the walls of the blood vessel contract to limit the flow of blood to the damaged area. Then, small blood cells called platelets stick to the site of injury and spread along the surface of the blood vessel to stop the bleeding. Idiopathic or immune thrombocytopenic purpura, also referred to as ITP, is the most common platelet disorder in children. A peripheral blood smear on a slide is examined under a microscope, and a platelet count is also taken. This will allow the physician to make a diagnosis. Usually the platelet count will be low, usually below 50,000. In the last video, we discussed that a normal platelet count is 150 to 450,000. The good thing is that usually within 4 to 6 weeks, there is usually a spontaneous remission. Henoch-Schönlein purpura is a vascular defect that can occur in children. It presents with a rash over the buttocks, back, and legs. Joint pain and swelling may also be present. The platelet count, bleeding time, and coagulation times are usually normal. And again, the outcome will usually be good. Meningococcemia can also produce purpura, so meningitis must always be considered. Other infective states may also produce a septicemia, which can also result in purpura. Coagulation deficiencies, such as the inherited disorders of hemophilia A and hemophilia B, are each a result of one clotting factor. Remember that clotting factors are proteins in the blood that control bleeding. Septic states, severe infections in the blood system, which consume the entire system, are referred to as disseminated intravascular coagulation, also called DIC. These are the result of problems with multiple clotting factors. Now, when to refer is another important issue. I think we can make it simple. I think a referral to a hematologist should be made anytime a patient presents with abnormal bleeding. Now let's end this video on the topic of prevention. To prevent minor bruising, take steps to avoid falling. Use good lighting in your home. Avoid clutter and throw rugs, especially on stairs. Arrange furniture and electrical cords so that they're not in your way when you walk. Find out about the side effects of medications you take. Tell your doctor or pharmacist if a medication makes you dizzy or sleepy. These are side effects that will make you prone to trip or bump yourselves. Have your vision and hearing tested. Minor changes in sight or hearing can cause you to fall. Well, I hope this helps. Have a good day.